another episode of Doc Talk Live, a health show brought to you by Dallas Renal Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services. Information can be found on dallasrenalgroup.com or on the Dallas Renal Group Facebook page. It is also sponsored by Zyga Healthcare Group, a leader in providing senior living, home healthcare, and hospice-related services throughout the entire DFW Metroplex. My name is Dr. Vic Prakash, and I'll be hosting today's show with Dr. Sylvie Simon. You can watch us live on our Facebook page, and after the show, head on over to our YouTube channel called Doc Talk Live. Like, comment, and subscribe to see the great shows we have scheduled in the upcoming weeks. More details can also be found on our website, doctalklive.com. If you are a healthcare professional and would like to be on our show, send us a request through our website or through our Doc Talk Live Facebook page. Today, ladies and gentlemen, we have a great show on wellness and urgent care. Did you know that 92% of urgent care centers maintained wait times of 30 minutes or less in 2015? Joining us in discussing information like this will be Mr. John Shero and Ms. Sherry Lansdell. To be part of the conversation, give us a call at 972-235-5555. Again, the number is 972-235-5555. We'll be happy to take your questions throughout the live show. Mr. Shero and Ms. Lansdell, welcome to Doc Talk Live. Thank you so much for volunteering your time to be a part of the show. And tell our listeners a little bit about yourselves.
Thank you for having us on the show. We really appreciate it. My name is John Shero. I'm a CPA and a pedorthist. I'm on both sides of healthcare. On the administrative side, I'm also as a pedorthist and clinician. I'm the president of Primary Plus Urgent Care with one location on South Hewlin in Fort Worth. Also 2 locations in Dallas, one at Beltline and the Tollway, and one in Coit and Arapahoe. I'm also the president of Sports and Wellness, which is a company that focuses on diabetic shoes and inserts for your custom foot orthotics for shoes.
And my name is Sherry Lansdell. I am a ER nurse by training. I've been a nurse for 25 years, and I run operations for all of our Primary Plus urgent cares, as well as support patients using Sports and Wellness and Pride Pharmacy, which are 2 other entities that we incorporate at our urgent cares.
Well, thank you both for being on our show today. And if you're just tuning in, you're listening to Doc Talk Live. Today we are going to be discussing wellness and urgent care. So let's start it off. Over the past couple of years, we've seen a significant increase in the number of urgent care centers across the United States. Mr. Shero, could you start off by explaining what's the difference between urgent care and an emergency room?
A great question. A lot of people are very confused, and to be honest, it's really a big issue that the public needs to be aware. It's very important to know that an ER is an emergent care or life-threatening event. So if you're going to an ER, it needs to be a situation where you truly feel like that you're having a life-threatening event. Urgent cares have ability to do a lot of other type services. They can be more like a primary care if that's the case. We can also do things in urgent care, anything from school physicals all the way to broken bones. You have the ability to offer a lot more services, where emergency rooms are just that. They're for emergency to treat you and then either get you to a hospital or get you home.
Now, if somebody goes to an emergency room and they don't have an emergent condition, say they have a bad viral cold, are they seen in the ER? Do they get refused treatment?
It's a difficult situation to put a clinician in, because you really have to evaluate the need of that patient. But at the same time, if they have the feeling of an emergency, then you really have to be careful how you screen them and possibly screen them out. So you can be seen, and many times you will be seen, but if you go into an emergency department and you're seen, even if it's not an emergent situation, you will be billed as though you were treated for an emergency, which means you can end up getting a facility bill and you can get a physician bill. And it can be extremely costly if it truly was an emergency, but you were treated for an emergency.
Okay, I know every case is a little bit different, but can you give us some real-world numbers that you've seen in cases prior?
We've had situations, as a matter of fact, Primary Plus, we were an emergency room. And we converted from emergency to urgent care based on that very thing. We had a lot of patients that came in. They were very confused. We even did a study in North Dallas to determine how many people were confused, and we found that a majority of people didn't know the difference. We had people come in that had, in their mind, an emergent situation that their bill was in excess of $3,000, but honestly, they could have been treated in an urgent care for much, much less. And so it was really a reality that we needed to relook at our business and determine what the right thing for the public would be.
And when it comes to ERs, too, patients are entitled to a medical screening by law. So if anybody who walks into an emergency room is entitled to be screened by a medical professional, physician, mid-level, to establish if they are an emergency, a true emergency or not. We still offer that at Primary Plus because I want every patient to know that they can come in, get screened, and no cost to them, and we can establish what the plan of care, the best plan of care for them. So we're not going to do a lot of workup and then say, oh, by the way, you needed to go to a hospital. So we are making all of our mid-levels, our nurse practitioners, screen the patients coming in, because I think part of being there in the community is educating the public. Educating to them what is an emergency and what's not, and letting them know their cost ahead of time and not on the back end with a surprise bill.
I think that's fantastic. You know, when we talk about systems like this, it's important for our listeners to know how to utilize it so they don't get charged in excess because healthcare can be expensive. So if we all utilize it a little bit better, I think it makes a lot of sense. Now, you mentioned that urgent care does a lot of things that a primary care doctor's office would. So in what situation would you go towards an urgent care versus going to see your PCP?
Well, coming to an urgent care, let's say you're trying to get to work, kids are sick, and you can't get an appointment with your doctor. So even if you are established with your physician, that doesn't mean you're going to get an appointment that same day. We tend to focus on hours that are outside of your primary care physician, as well as trying to provide no appointment is necessary if they want to come in and make an appointment, but no appointment's necessary. We also offered a $5 B12 shot. Well, can you just imagine trying to book with your physician at home, saying that we'll get you in here about 2 or 3 weeks when you can walk in and we can have you out in less than 10 minutes.
Just to add to that, I want to also be sure that people understand a good urgent care is something that augments your primary care physician. We don't want to take their place. We want you to have a primary care physician. As a matter of fact, we want to communicate with your primary care physician. If you come in to see us after hours, we want to be sure and have you follow up with your primary care physician. We want to follow up with your primary care physician and let them know exactly what we did, what changes may have happened in medications or other things so that we can keep a continuity of care. And so there's absolutely no reason for an urgent care to ever be in competition with their primary care.
That's great information. Folks, if you're just tuning in, you're listening to Doc Talk Live. We're talking about wellness and urgent care today. If you want to be part of the conversation, give us a call. Number to the studio is 972-235-5555. Ms. Lansdell, what services are unique to your urgent care?
Well, just aside from just doing basic care, minor emergencies, we also offer IV therapy. Again, like John said, we used to be an ER, so we actually have imaging equipment that's equivalent to an ER status, and we do cash prices. So we are very competitive with our surrounding neighbors. So we're doing cash outpatient imaging at great cash prices for our patients that are coming in, or even for doctors' offices that would like to get there and get that taken care of. Also, like I said, IV therapy, that is something a lot for fatigue, migraines, overall wellness. We are offering that service to our patients also. And so you can get in, get a bag, get your energy, and run out and do whatever you need to do.
All right, we've got a live call. Hi, welcome to Doc Talk. What's your question for a listener? Great question. Let's ask our experts.
Absolutely. Our staff as well as our mid-levels are all qualified to treat infants all the way up to seniors.
All right. Mr. Shero, along those lines, what level of health care can you provide at an urgent care center?
Primary Plus is different in that we, because we were an ER, freestanding emergency department, we have a lot of services that other urgent cares don't. Most urgent cares really do basically primary care after hours. We have the ability, we have CT X-ray on site, we have lab on site, we have pharmacy on site. So we can do, as Sherry pointed out, we can do everything from IV therapy to X-ray, CT, imaging, cash-based imaging. So we're extensive as it goes to urgent care.
Okay, let's take another call. Hi, you're on Doc Talk Live. What's your question? I'm sure
Okay.
they'd be happy to share that.
Yeah, our website's Primary Plus, PLUS, UC.com. And right now we did send out a promotion to do $5 B12 shots. We are in network with Medicare and United Healthcare at this time. We bill out of network for Blue Cross Blue Shield, Aetna, and Cigna, but we should shortly be in network with those. And we're offering great discounted cash prices. My prices are far lower than most urgent cares because, again, we're trying to get our name out there and get folks to come check us out.
All right. Now, you talked a lot about hours. What are your hours?
We do from 8 a.m. to 8 p.m. Varied days, so Monday through Sunday. Some sites are closed on different days, so Hewlin is closed on Friday. Addison is closed on Friday and Sunday.
Okay. And what is the normal wait time that you average out?
My wait time is 0 to 5 minutes.
That's fantastic.
Yes.
All right. And Mr. Shero, you did mention this, but do you accept Medicare?
We do, and that's another huge benefit to the urgent care versus the freestanding ER. Freestanding ERs are not recognized by federal programs. The urgent care is, and we do take Medicare.
Okay. Ms. Lansdell, do you have any discount programs?
Yes, we are working on a discount program, like a membership fee, to where folks could get reduced cost of just a primary visit, a cash cost, and actually get percentages off our services also. So if you were a member, you would get between 10 to 20% off of a x-ray, an injection. Your office visit would be reduced from the minimum cash price is what we have.
Okay. We're about to head into our break in about 2 minutes, but let's transition into the sports and wellness portion of the show so that way it opens you up to more calls. Mr. Shero, what services do you provide in sports and wellness?
Sports and Wellness is a company that's really built around focusing on diabetic shoes and in-shoe orthotics. Diabetic shoes are really unique in that they are specifically for diabetics, and we also do custom orthotics for feet.
All right, let's expand on that, but we've got some live calls.
Okay.
Hey, you're on Doc Talk. What's your question?
Hi, good evening. This is Wayne Schick. We offer flu shots. I'd appreciate
Okay, great question. Do we offer flu shots?
Absolutely, and those right now are $5.
Wow.
So, and what the offering is that you can have, if you've already had a flu shot, you can have that repeated since the percentage rate was so low in terms of how well it worked on the first go around. So yes, we do have flu shots as well as flu testing. That's something else a lot of facilities have ran out of.
Okay. Now, Mr. Shero, you were telling us a little bit about the wellness portion.
Yes, Sports and Wellness is another company that's affiliated with our urgent cares. We do diabetic shoes, we do orthotics for plantar fasciitis, foot pain, that kind of thing. So it's a very focused company, and we use our urgent care locations, and we also have a facility in Granbury, Texas.
All right, we're about to head into our break. So in the meantime, call us during the break. We'll take your calls off air. We're discussing sports and wellness. You're listening to Doc Talk.